As a dermatologist who struggled with my own hyperpigmentation, which is one of the reasons I went into becoming a dermatologist in the first place, I'm here to tell you that if you're dealing with dark spots, uneven tone, or melasma, and if you're tired of using products that promise results but don't deliver, then this video is for you. I'm going to give you the exact 30-day approach that actually works, the same one that I used on myself and that I now teach to help others achieve clear, even, radiant skin. So by the end of this video, you'll understand exactly how to address hyperpigmentation without the internet confusion and overwhelm that keeps most women stuck. So let's talk about why many hyperpigmentation treatments fail and some of the biggest mistakes I see people making. Well, first, it's important to understand that hyperpigmentation or unwanted dark spots can actually occur in multiple levels, multiple layers of the skin. So we have the topmost layer, which is what we refer to as the epidermis, and then a level beneath that is what we call the dermis. Hyperpigmentation can deposit both in the epidermis and also in the dermis. Now, a lot of the over-the-counter treatments or surface level treatments are really going to only be able to reach that hyperpigmentation that is in the top layer of the skin, or target that melanin that is in the top layer of the skin. That leaves some more deeply deposited melanin behind, or some of that melanin that lies in the dermis is still there. And so that's one of the common reasons why you're not able to see a complete clearance of the hyperpigmentation in a way that you may have wanted to. Now, in order to fully treat hyperpigmentation in the way that's most effective, it's important to understand a little bit about how melanin is produced, or that biological process that's naturally occurring in our skin. To break it down a little bit further, UV exposure, hormonal changes, and inflammation can all impact tyrosinase activity. Now, tyrosinase is an enzyme that plays a crucial role in the overall melanin production pathway. If this pathway is not functioning properly or how we want it to achieve the optimal results, that can lead to an overproduction of melanin in certain areas of our skin, and that's what will then lead to what you visibly see on the skin as hyperpigmentation. This is why, in order to treat hyperpigmentation, you need a comprehensive approach. Successful treatment of hyperpigmentation requires preventing new melanin from forming, accelerating the cell turnover where we already have that excess production of melanin, and then also at the same time preventing inflammatory factors that contribute or worsen the overproduction of melanin in those areas. Studies show that combination therapy can be up to 60 to 80% more effective than just single ingredient therapies alone. Other reasons why maybe some of your favorite expensive serums are not as effective as you would have hoped is that the ingredient concentration does play a role. For example, we've seen in several studies that kojic acid is quite effective at about 2 to 4% strength, but a lot of over-the-counter products may have 0.1 to 0.5% strength. It's also important to consider ingredient synergy when you're putting together an effective skincare routine to help target your unwanted hyperpigmentation. For example, let's consider azelaic acid. Azelaic acid is known to work on many pathways that influence hyperpigmentation, such as the melanin production enzymes, anti-inflammatory benefits, and even processes such as keratinization, or how your skin cells progress through their cycle. Now, we've seen with this particular ingredient, when combined with a retinoid, which influences cell turnover, and a vitamin C, which has a lot of antioxidant protections, the combined effect can actually be increased by 200 to 300% when compared with just single ingredient treatment alone. I remember struggling a lot on my personal skin journey with trying to even out my hyperpigmentation prone skin, was dull, uneven, acne prone, and again, I was just picking expensive products, hoping for the best without really understanding how to take advantage of those well-formed products, or to pick ingredients that worked really well for my skin, and to make sure that I had a routine that really complemented all of the ingredients within it well. This can be a tough place because it's hard to rise above or fully understand how to maneuver the marketing claims to really get the results that we're looking for. This personal struggle among many was one of the top things that really led me to specialize in treating hyperpigmentation, the same things that a lot of my patients struggle with. By the way, if you want to learn my step-by-step approach to achieving clear skin without the internet overwhelm or confusion, check the first link in my description below. Okay, so now let's get into what a 30-day evidence-based hyperpigmentation protocol would look like. And we'll start with weeks 1 to 2. But before we do that, it is important to understand a few different subsets of what people kind of lump on the internet into this hyperpigmentation umbrella. So one of the top types of hyperpigmentation that you've probably seen, or that a lot of people are referring to when they mention this name, is what we call post-inflammatory hyperpigmentation, or PIH. This is going to appear as flat, discolored patches or spots or small circles or macules, and it'll typically arise after something like acne or a rash or a cut. Some type of trauma to the skin preceded that hyperpigmentation that came afterwards. That's what we call post-inflammatory hyperpigmentation. And this post-inflammatory discoloration, depending on the skin type, can actually range in color. So for some people, it might be a pink or red, which we would call post-inflammatory erythema, and it can range all the way to a deep brown. Another thing that you might see people referencing in this category is what we actually refer to as sunspots or solar lentigines. These are typically going to be kind of flat, light brown areas, light brown patches or spots or macules, typically in sun exposed areas such as the face, the shoulders, the back of the hands. These are what you would call sunspots or solar lentigines. Then something else that we commonly see people talking about is going to be melasma. This is typically going to be bilateral. It's going to be on both sides of the face or wherever it presents. Typically presents as patches, sun exposed areas as well, and has a significant hormonal influence. So now we'll talk about what a skincare regimen might look like if you do have hyperpigmentation. Now, as a caveat, for sunspots, I personally prefer to treat those with a laser. I think they respond the best to that. And then of course, melasma has a lot of hormonal influence and a couple of specifics that we'll get into in another video. But in general, when treating hyperpigmentation, here are some skincare protocols that you can consider that would be helpful for you. So in the morning, you can actually keep your skincare regimen quite simple. I would say aim for a gentle cleanser that maintains your skin barrier, gently cleanses your skin without overstripping, and helps maintain a nice healthy pH for your skin. Then I like to follow with a vitamin C serum, which can have significant brightening effects for your skin. It's a great antioxidant and will really help protect your skin against all the elements before you go out for the day. Then I would like to follow with an SPF of no less than 30. Higher is better, so if you can get a 50, even better for me personally. Do make sure it's a broad spectrum sunscreen so that you are adequately covered throughout your day. That's going to be really important for hyperpigmentation. Then for your evening routine, if your skin is on the more sensitive side, you can start slowly by introducing an ingredient that specifically targets hyperpigmentation, such as an azelaic acid or kojic acid or a tranexamic acid. These are going to help to slowly start to fade away that hyperpigmentation over time. Then of course, you want to end by applying a nice nourishing skin moisturizer that contains things like ceramides or maybe even a niacinamide to help nourish the skin overnight and really contribute to your overall skin barrier support. If you are new to this, feel free to start with a lower concentration and give your skin time to adjust and build up a tolerance, especially if you're using higher strength ingredients or ingredients that are potentially irritating. For many people, especially if you have sensitive skin, starting with a lower strength active ingredient can help prevent irritation-induced hyperpigmentation. Data has shown that inflammatory responses can increase melanin production by up to 40 to 60%. So this is definitely something that we want to keep in mind when introducing new products to our skincare regimen. Now we can move on to weeks 2 and 3, where we start to intensify our regimen a little bit, maybe by introducing new ingredients or increasing the strength of our ingredients. Everybody is at a different start starting point. So of course, we always have to adjust accordingly depending on our own personal situations. Now, weeks 2 and 3, if you haven't done so already, might be a good time to start to introduce a retinol or a retinoid. You can start with the lowest dose available, say of your tretinoin or of your over-the-counter retinol. And I know the goal is typically to try to work your way up to using this every night, but I personally like to recommend starting slowly, maybe 2 to 3 nights per week, just to give your skin that time to adjust and tolerate the ingredient. This can actually be very helpful when treating hyperpigmentation because retinoids and retinols are known to improve the overall cell turnover. So the amount of time it typically takes, say if someone typically takes 28 to 40 days to complete that cell turnover cycle, the retinol or retinoid would decrease the amount of time it takes to complete that cell turnover cycle. So this would physically remove some of those cells that still contain that hyperpigmentation in the top layers. Now, because we're often using a combination therapy to achieve the highest results of our skincare regimen, I think that if you're introducing a retinoid and you're already using a potentially irritating ingredient or an acid, then it would be best to use them on alternating days, at least initially, because again, you don't want to overwhelm your skin and you want to give it time to adjust to the products so that you can tolerate them and they can do what they're meant to do. Niacinamide integration is another one that you can add during this time if you haven't already. It does have anti-inflammatory benefits and can also be helpful when treating hyperpigmentation. Now, this is another thing that I think is very important, especially because you are the one seeing yourself every day. You want to be able to celebrate your progress and track your progress to really learn how your skin is doing and also feel encouraged to continue the journey. So I think it's actually quite important to track your progress every day. Take a photo with consistent lighting every day so that you can really see how your skin is coming along and take note on what's working for your skin and what's not working for your skin. It's hard to compare your journey to the next person because everybody is going to respond differently, and this is one of the best ways you can start to get well acquainted with how you are personally responding to everything that you're introducing to your regimen. So take note, do you notice redness, burning, scaling? Is the hyperpigmentation improving? These are all going to be helpful things as you continue to hone your regimen down the road. Now, ideally by weeks 3 to 4, if we've reached a kind of steady pace and a comfortable pace, this is where we can really start to kind of optimize your results and optimize your regimen, and even consider pairing this with professional treatments if you haven't done so already. So if introducing those retinols or those retinoids went smoothly for you earlier in the process, now you can try to increase to nightly application if you haven't done so already. Now, if you have some more resistant areas that haven't already responded to the ingredients that have been working well for you, this is a stage where you could consider maybe layering in one more. So I've mentioned earlier things like a kojic acid or tranexamic acid. That cumulative effect could be enough to push you over the line to get you to your ultimate goals. Now, of course, depending on how quickly you want to reach your goals, professional in-office treatments are always going to give you that accelerated factor. Consistent skincare is important, it takes longer. So you have to decide if you want to pair that with an in-office treatment. And some of the things that we could consider in office include things like chemical peels. For instance, if we were doing a superficial chemical peel with something like a glycolic acid in concentrations that you wouldn't be able to get over the counter, this could help accelerate your results. We often use a combination peel, meaning that the peel has multiple ingredients that target your specific problem. This can help accelerate your results. Other things in office that could accelerate your results to achieving your goals when it comes to hyperpigmentation include laser treatments. For some people, this is going to be like a non-ablative fractional laser or an IPL or a Q-switch laser. It depends on what is being treated and the skin type that is being treated in order to keep things safe and effective. But many times combining with in-office treatments such as peels or laser treatments could help get you to your results more quickly and also improve how well your skin is responding to the skincare ingredients. The key is to stay consistent and also patient and keep some realistic expectations in mind too, because again, you don't want to push too hard. There's a fine balance when we're treating hyperpigmentation in order to get the results that we want without worsening any of the issues that we're trying to solve for. So maybe about weeks 1 to 2, you start to notice some increased brightness, your texture, the radiance is improved for the skin. And then by week 3 to 4, you might start to see a 20 to 40% improvement overall. And then you can continue to build from there. And then remember, documenting your process is going to be very helpful. So make sure you take photos every day with consistent lighting, a safe distance from the camera so that you can really track your progress as you go along in your journey. As far as ingredients, hydroquinone is still the gold standard for treating hyperpigmentation, but for people who prefer to avoid that ingredient, other alternatives, as we've mentioned, include kojic acid, tranexamic acid, azelaic acid. We've talked about antioxidants such as vitamin C, which help with brightening and keeping your skin well protected against oxidative stress throughout the day. We've talked about niacinamide as well. So again, it's picking ingredients that have a good synergy without overly irritating your skin in order to move you closer to your goals. So of course, fading hyperpigmentation in 30 days is totally possible if you understand exactly what your skin needs and how to target that appropriately without overwhelming your skin or overly irritating your skin. It is possible when you understand the right approach and stay consistent with proven methods. I went through this exact journey myself when I was struggling with my own hyperpigmentation, and it is one of the many things that led me to become a dermatologist, treating myself for the same issues that many of my patients now struggle with. If you want to understand my complete approach to achieving clear, radiant skin in 30 days without the internet confusion or overwhelm, click the link in my description below. I'll see you in the next video.